Hello, my name is Lee Bailey, and I'm a graduate student at the University of Central Oklahoma, and I'm really excited for you to have me today to tell you a little bit about anorexia nervosa. So, what exactly is it? Well, there's actually a lot that goes into a diagnosis of anorexia. Such a client would have a severe restriction of food intake, significantly low body weight, a fear of gaining weight, and really an overall negative view of their own bodies.
Hello everyone watching. My name is Anna and I am a recovering anorexic. I just spent the last few weeks in the hospital. I'm trying to get healthy after I collapsed at school a couple of months ago. At that point, I was eating about 800 calories per day, and the doctor said I have what they call restrictive type anorexia.
When we're talking about a diagnosis of anorexia nervosa, we're really going to be looking at two subtypes, the restricting subtype and the binging and purging subtype. In the restricting type, the client will have severe caloric restrictions, including excess dieting, fasting, and even excessive exercising. In the binge eating and purging type, the client will not only be engaging in binge eating, but they will also make attempts to rid the body of any excess calories or possible weight gain via self-induced vomiting, enemas, diuretics, and even laxatives. Now, when it comes to assessing the severity of anorexia nervosa, generally in adults we use the BMI, which is the body mass index. But for adolescents, it's a little bit more difficult than that, because with adolescents, as they develop and mature, they should be steadily increasing their weight. So if we have a case in which we see an adolescent who is failing to gain weight or reach their weight milestones, this could be indicative of anorexia nervosa.
My doctor told my mom that I could have a lot of health issues if I keep eating like I am, or not eating. But this is going to be really, really hard.
One of the dangerous things about anorexia is that if it's left untreated, there are many different physical and social side effects that can manifest. These things can include anemia, lethargy, bone density loss, low pulse, social isolation, brittle hair, and dental enamel erosion.
I guess something that can motivate me to get better is my hair. When I was about 12, I started to grow it out, and I loved it. But by the time I was in the hospital, it was so brittle that I couldn't even wash it without it just breaking off into little pieces. So this week I cut off as much as I could, saved as much as I could, and here I am. Just sick, ugly, and probably about to get fat.
Anorexia nervosa generally peaks between the ages of 14 and 18. Some patients have a single episode, while others may spend years attempting to gain weight and then relapsing, and that can become a very vicious cycle.
I think I was about 15 when I started watching what I ate. At first I got really into nutrition. I counted my calories, I portioned out everything, but I think it just kind of spiraled from there. The more I lost, the more in control I felt over my own body. And then the more motivated I got to lose, I guess. Now I'm 17 and wasted nearly a whole semester of high school just sitting in the hospital so that I wouldn't die. I know I can't live like this forever. I know I can't stay anorexic. But I just don't know how I'm going to live with myself once I get fat.
Now, there are a few characteristics associated with anorexia that may be warning signs that a loved one is suffering from this disorder. These can include eating alone, over-exercising, an obsession with what is considered healthy, and even a possible food obsession.
They're even making me eat with my parents now. I mean, I used to just take a lean cuisine into my bedroom and pick it apart until I kind of felt full. But now I feel like everything I put into my mouth is under surveillance by them.
When dealing with anorexia, we also see a lot of comorbid disorders in those suffering from it, including substance abuse, anxiety, depression, and even obsessive compulsive symptoms.
You know, I used to eat with my parents sometimes. I didn't want them to get suspicious or anything like that. And I enjoyed them. But whenever I ate more than I felt I deserved, or went over my calorie limit or anything like that, I just felt depressed. I felt worthless. I would constantly check my body in the mirror because I knew I could just feel the fat accumulating on my hips.
When it comes to the diagnosis of anorexia, we've definitely seen an upward trend in females between the ages of 14 and 20 over the last 40 years or so. However, anorexia nervosa can occur in males as well, even though females outnumber males in diagnosis in about a 10-to-1 ratio. For men, though, the perceived standard they may be attempting to attain is to be thin and muscular, whereas women, the beauty standard evolves around thinness alone.
I mean, just look at these models. Come on. They're thin, they're beautiful, they're famous. Who wouldn't want to look like this? I mean, they asked me why I became anorexic, but I have to ask you, how could you not when this is what the world wants? This is beauty, this is fame, I want to be this.
Along with a culture that revolves around thinness as attractiveness, there are also social risk factors that may in fact contribute to the development of anorexia. First-degree relatives with the disorder make it much more likely that a person will develop anorexia nervosa themselves. Now, this could be because of a genetic predisposition or from being in contact and learning from someone with maladaptive eating behaviors. Also, there are certain occupations, such as dancing, modeling, acting. These all value thinness, which may inadvertently promote restrictive intake or even purging.
I have always wanted to be on Broadway. Always. But Mom said I can't go into dance again until I get healthy, until I start gaining some weight. But she doesn't understand that if they make me fat, then I won't get casted. Nobody will cast me. Nobody will like me. I won't even like me anymore. I can't gain weight.
Taking a further look at these occupations, as well as Western society as a whole, losing weight is not seen as a negative thing. For some individuals who are suffering from the negative side effects of obesity, losing weight may be a positive goal to achieve. However, research suggests that 94% of college-aged women desire to lose weight. A major problem with that statistic is that many of those women probably don't need to lose weight for health reasons, but want to for the sake of beauty.
It wasn't even until I collapsed that my eating was even considered to be a bad thing. I mean, I was always getting compliments on how skinny I was, on how much willpower I had to skip dessert. Now all of a sudden, I guess I'm killing myself. So many people envied me for over 2 years. Now everyone has pity on me. I can't even turn to my old friends online for support because now my parents are watching everything that I do.
Unfortunately, this culture obsessed with thin has been around for decades. However, the last few years have made it even more rewarding to engage in the anorexia lifestyle. Online, there are numerous websites, support groups, and other resources that adolescents can turn to in order to find tips for maintaining an anorexic lifestyle, as well as make friends with others suffering from the same disorder.
I was a part of this online group called the Annas, which was short for anorexics. We would all log our food each night and what we ate that day and what we didn't eat and how close we were to our goal weight. I was only 5 pounds away whenever I collapsed. But, they were always there for me. If you had a bad day, if you went over your calories, if you went under your calories, no matter what, they were there, they supported you. And I miss them. I really do. I never met any of them in real life, but we were all there for each other online. But my mom won't let me have anything to do with them. They are my friends. They will always be my friends. I am an Anna.
Whenever it is that you're working with an individual suffering from anorexia, it is important that you realize that this is a huge life change that they're going through. They will likely lose their Anna friends, so it is extremely important that you fill in those holes with positive social support. They are also challenging a lot of core beliefs that they've held very dearly. They may even be proud of their ability to restrict their food intake. They may have even relished in the compliments that people have given them regarding their low weight. But most importantly, these individuals are at risk of death. Anorexia has one of the highest mortality rates of any mental disorder. And therefore, there are many components to consider when beginning to work with someone suffering from anorexia.
I guess that life is over now. I start to see my therapist tomorrow. Take a good look, everyone. This is the last time you're going to see me skinny.
The main approach I like to take when working with a client with anorexia nervosa is based on the empirically based cognitive behavioral therapy model. This approach challenges both the cognitive and behavioral disturbances that maintain this disorder and allows us to create a case formulation that helps both the client and the therapist see what progress has been made and why. Cognitive behavioral therapy, or CBT, is extremely collaborative with the client. I like to focus on changing eating behavior, cognitive restructuring, psychoeducation, and problem solving to help the individual overcome the disorder. Especially with adolescents, it is extremely important that the family is involved to help monitor and support healthy eating habits. I also prefer working with dietitians or the client's primary care physician to make sure that he or she is physically well throughout.
Hello again, everyone. So, I just had my first week of appointments with my therapist, and it honestly wasn't as bad as I thought. I guess I just expected a long lecture, how I should be eating more and blah blah blah, like my doctor was. But instead they just asked me a bunch of questions. But it wasn't like my doctor. Like when he would ask me questions, I felt like he was judging me. It's like the therapist actually cared. He didn't just read them off to me and check me off the list like the doctor did. I didn't even feel judged. I cannot say this whole process is going to be friendly and enjoyable, but at least my therapist isn't a jerk.
From the very beginning, it is important to start building rapport with the client. If he or she does not trust you, then you are not going to get very far with them. The first session really focuses on assessing their history of mental health problems, current motivation to participate in therapy, and current symptoms of anorexia and any comorbid disorders that may be present. It is likely that he or she will not be very motivated at first, so it may be beneficial to engage in motivational interviewing, which is a goal-oriented and client-centered counseling style that aims to elicit behavioral change. It is very important in this process to empathize with the client. Though the lifestyle they have been engaging in may be dangerous, it is also difficult for them to challenge that lifestyle. A cost-benefit analysis examining the pros and cons of staying versus recovering from anorexia may be extremely helpful in getting the client to see the benefit of treatment.
The therapist had me talk about the pros and the cons of staying anorexic and not being anorexic. I mean, of course, the benefits of staying anorexic is that I won't be fat and ugly, but I know the negative side of staying anorexic is that I can't go out and eat with my friends like I want to. I don't know, it's just hard. Either way, it's going to be really hard.
When it comes to assessing the many symptoms of anorexia nervosa, we have quite a few different instruments. The structured clinical interview for eating disorders is always extremely useful. The situational appetite measure scale is good to examine eating urges, while the eating self-efficacy scale examines current difficulty in eating. We also want to assess for other mental health problems, such as anxiety, depression. So the Beck Depression and Beck Anxiety inventories are great for monitoring those symptoms.
Well, I really liked how the therapist seemed to include me in the whole process. They kept asking if I had anything to add or if I felt comfortable. I didn't feel like I was being examined, though I know they were examining me for my anorexia, if that makes sense. I don't know, I just felt like my therapist really cared. It's like he was curious about my problems. He wasn't interrogating me. It's different.
A general session always begins with the weighing of the client and plotting of that weight. You really want them to be able to see their weight change over time. This also helps to see if there's any significant decrease in their weight, which could signal potential relapse. You then want to work together with the client to set an agenda for the meeting. Ask him or her if there's anything that they would like to add. You can then review the homework that you had previously assigned from the last session. Did they do it correctly? Did they find it helpful? Next, you want to talk about each of the topics that you've added to the agenda for that day. Based on the agenda and how well the homework from the last session went, assign homework to do over the next week. Lastly, it is very important to summarize the session for the client and ask for feedback from them. Make sure that they understand the homework and the agenda by having them explain it back to you. Also, be open to both positive and negative feedback. Let the client know that they are in power within the session and allow them to use that.
So it was like in my first meeting, I was educating my therapist on my own struggles with anorexia. But for the last few meetings, it's like I was being educated about myself in a way. We talked about, like, I guess there's a relationship between our thoughts and our emotions and our behaviors, and I never really realized that our thoughts and our feelings aren't the same thing. My therapist said that we all have these unhelpful thoughts that just kind of pop up in our heads and that make us feel badly about ourselves. And so he's helping me to learn how to find out which thoughts these are and challenge them. I've been filling out these thought records over the last week or so. Can you see them? So you pick out what the trigger is, and you find out what that makes you think, and then you challenge that on this piece of paper. Like, you literally write down your thoughts and kind of argue with yourself. And, like, for example, one of my triggers this week was I ate too much, and my automatic thought to myself was, I am going to get fat, and I really believed that. So my therapist had me challenge that and write it out. So a challenge to that was, I ate a serving size, and I'm still wearing the same pair of jeans I was yesterday. So I was really making a catastrophe out of it. So in doing so, it kind of is starting to become more natural. I'm starting to catch myself whenever I think of thoughts that are, I guess, harmful and that make me feel anxious. And it's been really helpful. I mean, before I would eat too much, and I would feel guilty about myself. So I would stop eating for a while. I would limit my calories, and that really contributed to my anorexia. But it's been a lot better now. I'm starting to realize just my thoughts weren't correct.
A major component of CBT is cognitive restructuring. When it comes to identifying and challenging automatic negative thoughts or unhelpful thoughts, it is always important that the client know that their feelings are in fact valid. If they tell you that they're feeling sad, it is not our position nor is it anyone else's to tell them that they are not. But the thought that pops in their head sometimes that calls them worthless or fat may not necessarily be true.
Now, though a lot of this thought challenging is making sense, and a lot of what we're doing in therapy is making sense, I still don't know if I'm happy about having to change the way I eat. I mean, I like being skinny. I like the compliments I get. I like the looks I get. I'm just really worried about changing the way I eat and how it's probably going to make me really fat. I mean, my therapist says that it's going to make me more healthy physically and mentally, and that I probably won't get as fat as what I'm thinking, if I get fat at all. But I really don't think he knows what he's talking about when it comes to that. I mean, I eat one donut and I swell up like a balloon for a week. But the therapist asked me to try out this therapy like it is an experiment, like we do in science class. My therapist hypothesizes that it will be helpful, and I hypothesize that I'm going to be a cow.
A very important component of anorexia nervosa treatment is regularized eating. We want to eventually shoot for the client maintaining a healthy weight and eating 3 meals and 3 snacks per day. However, we may have to start out with baby steps depending on how much they are already eating each day. We also want them to fill out a food log so that they are able to monitor how much they are eating, and then we are able to note their progress. We also want to shoot for a weight range instead of a specific weight goal. Weight fluctuates naturally, and we need to keep that in mind.
So, my therapist and I set a goal for me to eat 2 square meals per day. I've kept this log going. I log when I ate, what I ate, how much I ate, and how I felt after I ate. Now, there we go. Here's the last 3 days or so. I ate 2 meals yesterday, and the day before, and today. I mean, I know that a person is supposed to eat 3 meals per day, but honest to God, just eating 2 is really hard. But on the bright side, my parents have been very supportive of me. You know, my therapist sat down and talked to them and taught them how to be really supportive and encourage me without criticizing me, especially when I'm having difficulty. And that's been really helpful. At first, I hated eating with my parents, but I'm actually starting to like it. I'm getting closer to my weight range, and they're getting to be very proud of me. I'm supposed to have gained between 1 and 3 pounds the first 3 weeks or so. It's only week 2 and I'm half a pound heavier. And I'm using my thought records to help me challenge any negative thoughts or any anxiousness about getting fat. I'm really terrified about reaching that 3-pound mark. That's really a lot of weight. But my therapist told me to keep carrying out my experiment and writing down the challenges to my thoughts and just keeping my log, and it's been getting easier. It really has been. It's not easy, but it's definitely been getting easier.
You and the client will want to slowly increase the goal meal and snack intake every week. It is also important to keep a running case formulation to help you keep track of progress and difficulties throughout treatment, as well as develop a rationale for other components of treatment you may want to employ in the future. Is the disorder being maintained by an over-evaluation of shape? Is it by restrictive eating? If so, how will you challenge those issues?
I've had to learn how to label my own emotions. I've started to realize that when I feel fat, I'm really feeling guilty or depressed, which my therapist has helped me to see that anorexia isn't quite just a fear of food. It also causes a lot of anxiety and depression in a lot of people. I've also started to realize that my Anna friends weren't the best friends to begin with, after all. And I've had to start finding my self-esteem elsewhere. My therapist has been having me fill out this self-esteem circle. You see that? So, I'm supposed to make this like a pie chart and break it up based on how much of my mood comes from what sources. So today, 10% of my self-esteem came from my good schoolwork, 15% came from my dance accomplishments, and a whopping 70% came from how I feel about my body. So, more or less, I realized that if I'm having a fat day, that ruins my entire mood for the day. I can't believe how much I've let my own feelings about my body affect me. This whole anorexia thing has affected my life in many ways that I've never realized. Maybe this therapy isn't such a bad thing after all.
Along with monitoring food intake, you will want to help them overcome their fear of any foods they are currently not eating. A feared food hierarchy may be beneficial to use in this case. They make a list of 10 foods from easiest to eat to the most difficult to eat. One client, for example, started her list with celery rated as a level 1. White bread she rated as a level 5, and mozzarella sticks she rated at a level 10. As the levels increased on the list, the difficulty the client had in eating those foods increased as well. So, in session we started on the lowest level foods that would invoke the lowest amount of fear and anxiety response. As she got used to eating the food at that level, and it no longer produced that amount of anxiety that it was before after multiple feedings of the once feared food, then this allows us to move up the levels until she was eventually able to eat mozzarella sticks without feeling the previous levels of anxiety.
I just had my first mozzarella stick in 4 years.
Obsessive-compulsive symptoms may also be present in the individual with anorexia. Body checking in mirrors or by grabbing flesh to monitor body fat is extremely common and may actually increase anxiety in the individual. To challenge this, monitor how many times he or she is engaging in these body checking activities per day, and then set goals to slowly decrease this behavior. One method is to utilize a checking behavior time.
So when my therapist first talked to me about this whole body checking time, I thought he was crazy. Not gonna lie. I mean, my mom has been trying to get me to stop pinching my belly fat by yelling at me constantly for 2 months. But my therapist and I set up a time at 7 o'clock in the evening to be my body checking time. So if I ever feel the urge to pinch my fat throughout the day, I just have to remind myself that I can't do it right now, but that I'm allowed to at 7 o'clock in the evening. So that way I can put it off and my body pinching won't distract me throughout the day and I don't get yelled at as much by my mom. Now, when 7 o'clock comes, I'm allowed to check my body as much as I want. I can pinch my belly fat. And mom's not allowed to yell at me at that time. So if I'm standing in front of the mirror at 7 o'clock, I can pinch all I want, I can check all I want. But throughout the day, I'm not allowed to. I have to remind myself constantly, if I have the feeling throughout the day to check my body, that I can't until 7 o'clock. But here's the thing. 7 o'clock has come around every day for the last 4 days, but when it comes, I don't have the urge to check my body. And it's not like I'm still doing it throughout the day. I mean, throughout the day, I'm still reminding myself when I have those feelings to put off checking my body, don't pinch my fat, don't check myself in the mirror, reminding myself not to until 7 o'clock runs around. But when 7 o'clock comes around, I don't check my body. So it's like I've gone from constantly checking my body for 12 hours out of the day to not checking it at all. And all it took was for me to make this arbitrary 7 o'clock time. If I would have known how well this trick worked, I would have stopped checking my body months ago, years ago. It's just unreal. And it's kind of silly.
During the first month or so of treatment, it is very important that the client refrain completely from exercise. After their symptoms have been reducing for a while and their weight is beginning to increase and stabilize, you can then start reintroducing exercise into their lives. However, at first it would be a great idea to get them to exercise with friends by doing activities rather than strictly working out. In this way, they are not overdoing it as they once did, and they're building social ties with people other than those that are online and a support group were giving them in the past.
So, for the first time since the week before my hospitalization, I was allowed by my therapist and my mom to go to dance class. And not only did I go to dance class with my friends, but I went to ice cream afterwards and ate an entire twist kitty cone. I know it basically sounds like what every teenager is expected to do on a Friday night, but for me that was a life-changing event. I didn't worry about the calories in the kitty cone or if I were burning enough calories during dance to even deserve the kitty cone. All I thought about was how much I missed whenever I was in the hospital. I mean, that was 3 months of my life, 3 months away from my real friends. I cannot believe it, but I'm actually eating and hanging out with real people and happy. I mean, maybe my therapist's hypothesis was right after all.
At times, it may seem as though gains are being made along the way in therapy. It is important that those gains be maintained and built upon when therapy is over. As you begin to wrap up your intervention with your client, identify with them any personal problems they may have along the way and help them to come up with plans to challenge them on their own. It may also help to externalize anorexia. Though dangerous, anorexia is a major component of their life. If you help them to frame it as anorexia destroying their life, it may actually help them to change.
So my therapist and I only have a few sessions left, so we've been starting to make plans to help me stay strong after therapy has ended. So, for example, if I start feeling pressured by the automatic thoughts that tell me I need to be skinny, say if I have like an audition coming up and I'm worried that I'm not thin enough to be casted as the lead or even in the play in general, then I will challenge those just like I have been doing. My therapist has helped me to see that I can challenge a lot of these on my own, and it's really helped me feel a lot better. I'm no longer going to let those thoughts tell me that I'm not good enough because I know that I am. I'm no longer going to let those anorexic thoughts make me lose my hair, make it brittle. Even though I really like this new haircut, I think it's growing on me. I'm not going to let anorexia control me anymore. And we've been problem solving for the last couple weeks to help that stay true and to help me stay true to myself. And I will never let anorexia control me again.
When ending treatment, it is important to explain the differences between a lapse and a relapse. If the client has a lapse in treatment maintenance and skips a meal, it is not the end of the world. Just have them problem solve how they will prevent it from happening in the future. Also, it may be a good idea to have the client schedule a booster session 3 months after the end of treatment. And this helps to identify any potential problems or gains in treatment. It is also important to watch out for any suicidal behavior. Sadly, this is common in those suffering from anorexia. Careful monitoring and prevention is most important throughout the recovery process.
Now, of course, there were times where this process was really difficult. There was even a point where I wondered if killing myself was better than being fat. But now it's been 6 months since I was hospitalized, and I'm 10 pounds heavier today, but that's a good thing. I'm healthy, and I have actual friends that support me to stay that way, to stay healthy. I hated the doctors for calling me sick. I hated my mom for worrying about me and yelling at me. I even hated my therapist, even though he was just trying to help. But worst of all, I know now that I hated myself because I hated myself. I hated my body. Now I love myself, and I love everyone who has helped me along the way. You know, I still have a lot to maintain. I still have a lot to do, and it's going to be hard, but I also know that I'm happier than I've ever been in my life. Thank you all for the support, and goodbye, Anna.